typical day would usually have us start out in the morning, get in the vehicle and travel to the patient's houses. And while you're in the vehicle, reviewing patients' medical histories. First, you reconcile everything you can from the chart perspective, prior to talking to the patient. I thought it was kind of fun. It reminded me of almost like a drive to like a family drive. When you're in the clinic, there's not quite that same interaction because you're physically separated from your other coworkers. That was a cool experience, and just kind of redemonstrated what was important about this home care. Dr. Chiang is already kind of established and like almost like a friend or like a neighbor kind of feeling. For me, I was also I was new. That humility of them allowing you into their space as kind of a fellow human neighbor, and then all like the personal things about their lives being there and kind of laid bare for everyone to see, and you can kind of get a little bit of personality there, which is really interesting, I think. And you don't get that in an office appointment, I guess. It allows you to kind of establish rapport really easily because you can just ask about things on the wall as opposed to conjuring something up in your mind. Just being there and just being like, hey, who are these on the wall? And it's much easier to just kind of chat with people about their space. You'll have more time to spend with the patient and to kind of go over everything. And rightly so, because you need a lot of time to ask questions and to really go over the more intensive needs of the patient. And then also, all the other things that come with being in a home space is you always have their medications there no matter what. They might not bring it to an office visit, which is huge because, you can virtually reconcile their medications as much as you want, but you don't know for sure exactly what they're taking because there's always this mystery, and you can only ask so much and gather so much information when you're admitting someone back to the hospital. In that case, they're just going to come into the hospital and they're going to be continually readmitted, which is a shame because you should have some sort of continuity. The whole thing makes me think of like a big circle. There's the office, there's the hospital, there's home, and of course there's the ED. And there's people in that whole loop. A loop is only strong as wherever it ends. And if there's one broken point along that loop, then it all falls apart. I guess what I'm trying to say is that's the importance of home care. HCCI's online program modules are really critical to developing the proper way to engage with the home care space because as simple as it sounds to go to someone's home, it needs a lot of prep work, almost like choreography. There are distinct rules and parts of the visit, and you really need to commit those to memory and work those into your Rapport system to make it smooth. The HCCI courses corresponded pretty much exactly to how the actual visit went, because the provider goes over the exact same things every single time, and because it's an organized module, you'll see the exact same thing at the visit too, because it has to be the same in order to provide that good care. And of course, there's nuances to daily things that happen too. So that's not going to be captured exactly. So you'll have to actually provide the care to experience those things. Dr. Chiang, what do you think the most important part of a home visit is?
I think the most important part of a home visit is being at the home. There is no other space in medicine that offers the richness, the personal connection, the information that you can obtain, and the transformational process that happens not only with the patient, but also to a provider. No other place in medicine can offer you that opportunity to make a dramatic impact in the lives of these patients who desperately needs healthcare on an ongoing basis.
I would summarize the home call experience as being effective and sacred.
It's really important for residents to have the house call experience for a couple of reasons. One, it is enriching. It brings the person back to the center of your care. But being at the home, it forces you to open up. It forces your eyes and all of your senses to engage, to see what their interests were, to see what they eat, how they live. And the other benefit to house call visits are you can have the opportunity to gather information, whether it's medication related issues, some mobility related issues, caregiver related problem. Even if you never go into house call medicine, we want to equip you to be able to take care of complex patients and never forget the personal side of the individual that you're caring for. Maybe 10 or 50% of residency across the nation offers residents the opportunity to go into a patient's home on a consistent basis for an extended period of time to learn the process, again, of taking care of the elderly, the multi-complex, and to get the experience of how to assess for social determinants of health when you're at the home, which, as we all know, makes a huge impact in the lives of our patients. So it is unfortunate that I think not more residency programs are offering the house call experience to their residents. They're missing out on the opportunity to deliver value-based care to these patients without resorting to using the high cost centers of the hospital or the emergency room, which we've done in the years past with fee-for-service. When I have the opportunity to share my passion of house calls with another provider in training, I am so happy. And I think it's contagious. I hope it's contagious in the sense that sharing my passion, my knowledge, my learnings with them and equipping them to take care of their patients in the future, whether they do house calls for a full-time job or part-time job, or even being in the clinic. Having had that experience of being in the patient's home, seeing what it is like, getting the information, seeing the dynamic of how medication impacts the lives of the patient, or the interaction between the caregiver, the daughter and the patient, for example, and helping them better manage these sick, elderly, complex patients, no matter what type of setting they're in. I have to remind myself why I went to medical school and why I became a doctor. Being at the patient's home with respect and courtesy, and never forget that sacred relationship that exists between the patient and the provider.